as the crow flies on the Vance Crowe Podcast.
The thing that really irked me was the mask discussion in the US. Because the Surgeon General told the people on Twitter that they should stop buying masks because masks don't help the general public.
Yeah, they did.
Also, they are necessary for the medical system. So at this point, basically every nerd said, you guys just voice the contradictions. Masks help, but they don't help you. For no reason, right? Why are you saying this? And some of these nerds get really upset. Because you need to be a normie to be able to understand that statement as logical.
It was logical to me. I was flying on planes and I knew about coronavirus and I had masks sitting in my house.
Right? So this guy is an anointed authority, basically something like a priest, and therefore what he says must be true. And I thought, oh my God, this is so stupid, because I understand the motive behind this is, the Surgeon General just casually admitted that didn't occur to him to order masks for the hospitals in January, when this was inevitably coming. Right? It's not that the world is generally unable to produce masks, but the supply chain is not arbitrarily elastic. It takes basically a couple months to make more of the raw materials and to set up the production chains, but it's possible. So what would have needed to happen is to increase demand in January. Basically put out all the orders in January, especially for the government suppliers, for the government needs. But this didn't happen for some reason. I thought, this is impossible. Why are they not doing this? They must have paid experts which look at these things. And it was not apparently happening. And the Surgeon General was not concerned about admitting that he was unaware of the fact that he would need masks for the hospitals and healthcare providers before even the last idiot in the public noticed and went to Home Depot and bought everything. Also, this idea that the hospitals would go to Walmart and Amazon to get masks after the public did strikes me as stupid. This is not how you do your supply. You typically have a separate B2B supply chain with very specific certifications, and you don't get a sanding mask N95 from Home Depot. The fact that our healthcare providers are now using these is not a testament to our level of preparation. But it's when you look at the actual studies, there is not a single study that I am aware of that says masks don't help the general public, or they only help you when you're already infected. And it's relatively easy to find a number of studies that tell you that yes, masks do help against respiratory diseases, even when not used by experts. And so we suddenly had all these stories of medical professionals telling the public how complicated it is to fit a mask, and that a mask doesn't help anything if you don't fit it in an extremely complicated day-long procedure with lots of aspartame and other people that help you while you hop down and test the fit of your mask. It was completely bullshit. It was a non sequitur. I don't doubt that this fitting exists and that it makes a big difference. Especially if you are a medical care professional who is working with highly infected people in large numbers at very close distance, right? This is a very different situation than when you are in public transport or when you go to a supermarket and you rub shoulders with some people there, of which some are infected, but still it's a matter of reducing viral load.
Yeah, that's what I've heard lately, or read something this morning about that the dose is really important. How big of a coronavirus dose do you get may determine how sick you end up getting. So somebody that's exposed to a family member by being in constant contact with them while they're going through their incubation period, way higher dose than if you're passing by somebody and happen to breathe some in. And if you have a mask there, that they're saying that might be why South Korea, Japan, Singapore, those places were able to contain it so much faster.
Yeah, if you look at a country like Singapore, if you think of Singapore as a patient, and you think of every infected patient as a virus in Singapore, right? You have a similar thing going on. If you start with a much smaller number, you can do contact tracing, you can mount a response, you have ICUs, you can deal with this in much easier ways than when you are in a situation as Iran, where when you notice the disease, it's already spread very far and very wide, and even some people in government are affected, and now it's very difficult to mount a response. And this is the situation that you're probably in when you are a healthcare professional and somebody is coughing into your face, and you end up with a much, much higher initial load of viruses in your body. So your immune system has no time to prepare, while the invasion force is relatively small.